Hey, I'm Bryan Mills. I'm the President and CEO of the Community Health Network, and I'm so delighted to be here today. And what a wonderful turnout for this fabulous historic event. And thanks for being with us. And there's people have questions afterwards. Some of us will stay around to answer those questions. It's my pleasure this morning to have Governor Mike Pence present. Mike's the 50th governor of this great state. I'm inspired by him every time I'm around him for his ability to continue to push this state to higher levels. And whether that we're talking about economic development, or whether we're talking about educational opportunities, or whether we're talking about fiscal responsibility, he continues to launch new trails and take us to places that sometimes I don't even think we thought we could achieve, but we do. As it pertains to health care, Governor Pence has been a very good partner, a very good friend, and a stalwart to do everything we can to improve the health of our Hoosiers. I had the personal opportunity to work with him hand in hand as he was negotiating with the federal government to get a waiver for HIP, and that was almost a year ago now. And to put something in place that is different than any other place. And it has personal responsibility. And it gives Hoosiers the chance to have the pride of having health care, to have a health care card that so many of us just take for granted. And we're seeing it in our hospitals like we have here at East. And tens of thousands of people have enrolled in the Healthy Indiana plan and are receiving health care like they didn't have before. And then we have this issue with drug addiction. And he put together a task force, and Tim Kenley, one of our physicians, is part of that task force, and he's here today. And we've talked about what do we do with awareness and prevention, and how do we work in hand with the law enforcement officials to say, how do we battle this? Well, what we're talking about today has a lot to do with that. And we have to engage, we have to invest, we have to spend time, we have to engage all facets of our government, our healthcare network, our law enforcement officials, our physicians, and just people to understand what's going on. So I'm delighted to have Governor Pence come to the microphone right now and give us his words on this event. Thank you so much.
Thank you, Bryan. Thank you so much for the hospitality today, and to the whole team here at Community East. We are so grateful to be joined by so many honored guests who are here today. In ways that Bryan just described very eloquently, Indiana has emerged as a national leader in medical research and innovation. Our strong healthcare system, our university research programs, our life sciences industry, and the Healthy Indiana plan that has now enrolled more than 300,000 Hoosiers in healthcare they can afford, that encourages them to take greater ownership of their healthcare future in the state of Indiana. Our state has emerged as a leader in healthcare. Today, in partnership with Community East Hospital and Community Health Network, we are beginning a new era for treatment of mental health and addiction in the state of Indiana. As governor of the state of Indiana, I'm pleased. I'm pleased to announce our plans to construct a new state-of-the-art mental health hospital on this site that will be open by the year 2018 to accept patients. With the establishment of the Indiana Neuro-Diagnostic Institute that will literally be constructed on the site where we stand today, Indiana will take a decisive step to add public mental health innovation for the benefit of some of our most vulnerable citizens and their families to the very center of healthcare policy in the state of Indiana. I'm extremely grateful. I'm extremely grateful to all of our partners who are with us today. Bryan Mills and the Community Health Network participated in the process of offering a proposal to make this happen, and join me in congratulating Community Health Network and Community East for their successful efforts. I'm also extremely grateful, and you'll hear from these folks in just a minute, I'm extremely grateful for the professionalism and the compassion of those who have participated in making this happen. Dr. John Wernert, who is actually the first psychiatrist to lead the Family and Social Services Administration in the history of the state of Indiana, has done yeoman's work, and later will explain the changes that we're actually making in the model of care that will be administered. But Dr. Wernert, we thank you. We congratulate you for this extraordinary step forward in healthcare. To others on the stage who are with me today, members of my cabinet, who you will also hear from momentarily, whose responsibilities will greatly be enhanced and strengthened by this new resource in Indiana. Judge Mary Beth Bonaventura, who leads the Department of Child Services, Superintendent Doug Carter, who leads the best state police force in America, Senator Luke Kenley, the chairman of the Appropriations Committee. Thank you all for working together to make this announcement today a reality. I am grateful to share the stage with each of you. We also have other partners in the General Assembly that are present, other members of our cabinet, but I wanted to mention Senator Mike Crider, Senator Jim Merritt, and probably the leading voice for health care reform in the state of Indiana now and for many years, Senator Pat Miller joins us today. Join me in thanking all of these outstanding legislators. She stood up, you can. Pat Miller certainly deserves it. This is a great day for Indiana. Senator, thank you. Today, Indiana has 6 state hospitals all across the state of Indiana. And this new Neuro-Diagnostic Research and Treatment Institute will actually replace one of them, the LaRue Carter Hospital here in Indianapolis, Indiana. The capacity of this facility, it will be able to treat, as you will learn in great detail today, will have 159 beds, but it will be able to treat some 1,500 patients with a new model of care that Dr. Wernert will explain in just a few moments. This new hospital will also serve as the flagship of our ongoing commitment to improve mental health care and address the scourge of mental illness and drug addiction in the state of Indiana. And I thank all of those who brought us to this place. A little bit of history is worth noting. In the 1950s, Indiana had over 6,000 state public psychiatric hospital beds throughout 13 operated mental health facilities. And as was the trend in states all across the country, that changed over the years. FSSA today manages only 800 beds spread over the 5 remaining adult hospitals and a small Evansville Psychiatric Children's Center. This decline in inpatient psychiatric capacity, as I mentioned, is a national phenomenon, which was accelerated as community hospitals around the country have limited or closed inpatient psychiatric beds due to issues of reimbursement, liability concerns, and the perceived availability of outpatient care. As state hospitals have been closed over the years, patients with chronic psychiatric disease and relapsing chemical dependency and addiction have often become homeless, moved to nursing homes, been cared for in emergency rooms and general hospitals, and most troubling and most disturbingly, many have simply been placed into Indiana's jails and prisons. The Indiana Department of Corrections informs me that today, of the 30,000 incarcerated individuals in the state of Indiana, an estimated 50% of all the inmates in our jails and prisons have a primary mental illness or substance abuse disorder. it is deeply troubling to recognize that our prisons have become the state's largest mental health treatment provider. Today, that begins to change. And as I mentioned, this new model of care, which Dr. Wernert will explain in greater detail, includes also specialty units. Specialty units including addiction treatment, for which I'm especially proud. As many of you know, on September 1st, in response to a widening crisis of drug abuse and addiction in the state of Indiana, we established a new task force, the Governor's Task Force for Drug Enforcement, Treatment, and Prevention. Many of the participants and experts who are with us today have been doing yeoman's work. We recognize the need for strong law enforcement. In the coming session of the General Assembly, we'll do our part to make sure that Indiana is the worst state in America to profit from the sale of illegal drugs. We'll get tough on those that deal drugs to our kids. But one of the early conclusions of our task force and the counsel of the people at the very heights of our law enforcement community is we cannot arrest our way out of this problem. The reality is that drug abuse and addiction must also be addressed through expanding our capacity and our treatment options in the state of Indiana. So make no mistake about it, this announcement today is about confronting mental illness in Indiana. It's about creating new options for treatment for Hoosier families that are struggling with a family member caught up in mental illness. But this is also every bit as much about responding to the crisis of drug addiction in the state of Indiana and the role that it plays in public safety in our state. We cannot any longer allow Hoosiers afflicted with mental health and addiction disorders to fall through the cracks, or to fall into wrong choices, or to fall into the consequences of those wrong choices. The specialty units with this Neuro-Diagnostic Institute will be part and parcel of demonstrating the deep compassion of the people of Indiana to come alongside hurting Hoosiers and their families and provide the kind of treatment and care that every Hoosier would hope for their family. Effective treatment, we're told, of substance abuse is often best administered with an operative mental health regimen. The accurate diagnosis of mental health issues will actually, I'm told, allow substance abuse treatment providers to more quickly address the needs of addicted individuals. We are, in every real sense today, making an investment in the health and well-being of Hoosiers, but we're also making an investment in communities that will be safer for their families and for ours. Construction will begin next year. The facility is currently scheduled to begin serving patients in 2018, and I'm excited about the commencement of that work today. Today's announcement is evidence, once again, of the professionalism and outstanding reputation that Community Health Network enjoys. And to Bryan Mills and the entire team here that each and every day show the compassion and are the hands and feet of the very heart of the people of Indiana. We give you our thanks for this new partnership. So I say, welcome to a new era of treatment of mental illness and drug addiction in Indiana. May God bless the Indiana Neuro-Diagnostic Institute and all who will serve and be served in this place. Let's get to work.
Governor, thank you so much. And again, your vision and leadership on this particular issue has been crucial. It's truly an honor for me to be here on this stage with my colleagues, but also with Mr. Mills and the governor. They really define what courageous leadership is about, and this is meaningful reform in our mental health system. I want to take a moment and recognize many of our advocates and my colleagues in the room. Again, I would just emphasize what the governor accoladed on Senator Miller. She has been an absolute stalwart over the years, and Senator, thank you again for all that you've done to make this possible today. I see our friends from Mental Health America here in Indiana, Steve McCaffrey and his team. Thank you all so much for your ongoing work in the community and with families and those affected by addictions and mental illness. Our friends from NAMI are here. I would also note that we have Matt Brooks and many of our friends from the Community Mental Health Center system, medical directors and CEOs. Thank you all for coming. We also are very fortunate to have a number of medical colleagues and psychiatric colleagues. We have many of our psychiatric medical directors from our other state facilities who made the trip to be here today, and also our physician leaders from various organizations, including State Medical Association and the Indiana Osteopathic Association. And I think all of these groups being here today really emphasize just how important this institute will be in the future of mental health care in Indiana. Now first, let me make sure we all understand what neurodiagnostic means, because it may be an unfamiliar term to many of you, but you're not alone. It's unfamiliar because it's really a different term to describe a concept of treatment that we intend to embark upon. Neuro obviously is pertaining to the brain, diagnostic, pertaining to the techniques used in appropriately diagnosing illness. And the focus of this new institute will be on the precise diagnosis and the assertive treatment of brain-based disorders. And that includes chronic and acute mental illness and psychiatric disorders, things like schizophrenia and bipolar disorder, chronic addictions and substance abuse disorders, intellectual and developmental disabilities, including autism, traumatic brain injury, and neurodegenerative illnesses such as Alzheimer's disease. Accurate and comprehensive diagnosis drives more effective treatment and better outcomes for our patients. So how do we do that? Well, first, we utilize what's available in today's marketplace and using brain imaging technology, much like we use in cancer care, to isolate the disease process in the brain. We also will be employing up-to-date genetic testing to predict treatment outcomes, psychological and cognitive testing to determine appropriate prognosis and outcome. But this institute also will encompass an important concept of integration of medical care. And this is where co-locating this hospital on the grounds of Community East, this collaboration, this partnership will bring state-of-the-art medical and psychiatric care together for a population very much in need. The governor mentioned the history of our system here in Indiana, because for well over 100 years, the state of Indiana has provided very compassionate care for the mentally ill in our state-operated hospitals. But that historically has been a custodial model of care, of long-term care. And with the deinstitutionalization movement that started 50 years ago, previous administrations have closed 7 of these facilities over time. But now it's important that we look to the future. It's our bicentennial year, and it's rightly so that we focus on our future. So how do we increase access and improve quality for mental health treatment for our citizens? Governor Pence and our colleagues and partners are taking a bold step today to reverse this failed trend. This Neuro-Diagnostic Institute and Advanced Treatment Center will be the flagship of a new and improved system of state-operated facilities. This integrated system of state hospitals will develop centers of excellence and leverage our psychiatric expertise across the state. We will leverage telemedicine technology to provide statewide access to our experts. The need for this new facility will all be about diagnosis and treatment, but even non-clinicians understand that it's important that you first have to get the diagnosis correct to drive the most appropriate treatment. And many treatment failures are a result of inaccurate diagnosis, which means sometimes patients are getting less than optimal results. Once we have the correct diagnosis, we can then use the most up-to-date treatment protocols and research-based treatments. Our goal is that once patients are improved, once they're stabilized, once they're better, we want to support them in the community and keep them well and not allow them to slip into relapse. Our goal is also to divert patients with brain-based disorders away from incarceration in our overburdened jails and prison system. This center will leverage the diagnostic capabilities of the community hospital system as our partners in care. And what a great opportunity this will provide, a great training site for our next generation of mental health and addiction providers. By utilizing community's medical expertise and specialists to treat many of our patients with serious mental illness who also have significant health issues, diabetes, heart disease, lung disease, all of these conditions can worsen their brain-based illness and make treatment much more complex. Therefore, it is essential that the patient be approached holistically and that this new institute will lead the way in integrated care. I want to follow up on one of the governor's points. It's important to emphasize this new institute will not merely replace LaRue Carter Hospital. It is a new model of care, and it'll be a new model of care for the entire state. And we're going to build on the successful mission of the LaRue Carter Hospital, but modernize it for the 21st century. We will be able to diagnose and treat a wide variety of patients better at an earlier point in their brain disease process. And through early intervention, we can dramatically change the course of illness. And most importantly, we'll save lives, we'll relieve suffering, and improve outcomes. A little bit about the center now. We have boards here on the side that show you renderings of the new facility. We'll go actually across the road on the corner of the property here, and the new center will cost approximately $120 million and will be financed through 20-year taxable bonds left through the Indiana Financing Authority. Bond payments will run from 2019 through 2039. The governor mentioned this will be a 159-bed facility with 7 floors, as you can see from the pictures. And within the hospital, we're going to have specialty units, including expanding our child and adolescent capacity, a 30-bed children's unit, 12-bed adolescent unit. And in addition, we're going to have a 12-bed unit for folks with intellectual and developmental disabilities, 12-bed substance abuse and dual diagnosis unit, and a 24-bed forensic unit to work in concert with our colleagues from DOC. Commissioner Lemons is here today, and I want to again emphasize and thank him for his support, because as the governor mentioned, many of our most seriously mentally ill Hoosiers are incarcerated and need this level of care, and we'll be able to now obtain this through our new facility. We will also have a 12-bed research unit, which will allow us to continue to innovate and move forward in the world of scientific discovery with this population. And maybe most importantly, this will be an outstanding training site for medical students, for psychiatric residents, for primary care residents, nurses, psychologists, social workers, fulfilling again another important mission of LaRue Carter Hospital. This is a new day, and we are extremely excited, and I thank all of you, particularly the advocates and all of our colleagues who came out today to show support for this important hospital. But we also must recognize that this doesn't happen without our friends in the General Assembly and in the other agencies of state government. So it's now my pleasure to introduce one of those who's been a real leader in this project, Senator Luke Kenley. Senator Kenley is the chair of the Senate Appropriation Committee and has been since 2008. He was elected back in '92 to District 20 and has been a capable representative of his district. But from our standpoint, a big advocate for re-engineering our state system and improving quality of mental health treatment in our state. So I'd like to introduce Senator Luke Kenley.
I think John should run for office because he can say in 1,000 words what you should say in 50. So. John came to my office and he pitched this plan when the Senate had the budget bill, and I listened to him for a while and I said, John, does the governor know that you're proposing this to me? And he said, well, sort of. And so I listened to John, and the thought going through my head was that the timing is right for us to do this kind of thing. So I went down the hall and I asked Senator Pat Miller, who we call Mom, giving away too many secrets here today, Pat. I said, do we need to do this, Pat? She said, Luke, if you think we can get this done, we need to do it. And so from that point, And Mike Kreider had another plan, and he'd done some volunteer work at the hospital out in Hancock County, and he said, we need to do this. So we put it in the budget bill, and we kind of put it back in the governor's lap to see what they would do with it. And what Mike Pence has come up with here is a plan to efficiently and effectively build a building in conjunction with a partner, community hospital, so that we have not only a good building at an appropriate price, but that we have the best possible quality services that we can get in this particular area of great need. And the partner that he selected, his team selected, was Community Hospital and Bryan Mills. And Bryan and I are neighbors in Noblesville. And so in order to close the loop, I went to Bryan and I said, Bryan, I said, people in the political world, they come and they go and they have big plans and big ideas, and they're always a great thing to do, but if it's not executed now and forever, it really won't work. And so what I want to know is, will Community Hospital be the partner that is our steward that makes sure that this works for the entire life of this structure? And those of you who know Bryan like I do, when Bryan said yes, I thought, well, that solves that problem. And so Tim Brown, the chairman of the Ways and Means Committee, who's a doctor himself, was very supportive and very helpful in this process. And so that's kind of how it happened. And John deserves so much credit for bringing the idea forward, and the governor deserves so much credit for seeing how to do this in the best way possible. So I'm just pleased to be a part of the program. Thank you.
Good morning. Well, I'm glad. I think I'm going almost at the end. I'm Mary Beth Bonaventura, Director of the Department of Child Services. And I wanted to go at the end so I couldn't be criticized by somebody about my speaking manner. There's a lot to be critical about, I assure you. Not the least of which is I came up with my Kleenex and not a notepad to read from or to look at for help. But honestly, you don't really need any help to talk about something that you've seen happen for a 31-year career as a judge up in Lake County. And what I saw over 31 years was that people would come into court for a variety of reasons, and it was in juvenile court, so we dealt with child abuse and neglect. And we would see time and time again, family after family, suffering, parents suffering from unattended, untreated, or mistreated mental health issues. And because of that, their children had to come into the system, removed from their homes, and sometimes separated forever from their families because the parents suffered from a disease that there was no help for. The flip side of that is that for 31 years, we saw really an injustice to children who suffered from mental health or addiction, having to have the police called on them because there was no help in their community to address that need. They were removed from their homes because parents were told to abandon them so that they could get the help from the Department of Child Services that they couldn't otherwise get. Kids walked around with the stigma of having a delinquency attached to their name or being a child in need of services and removed from their home because there was no help in the community. And I'm proud to say that as director of the Department of Child Services, about a year ago, we rolled out statewide an initiative in partnership with FSSA and Department of Mental Health and Addiction and the community mental health centers, what we call the Children's Mental Health Initiative, so kids no longer have to be arrested or made chins to get help, that for the first time, children and families are receiving mental health services without the coercive intervention of a court. And for that, it's life-changing for children and families. I think Dr. Wernert nailed it right on the head when he said about the diagnosis piece, that, you know, what I've learned from being lucky enough to be on the governor's task force for the drug problem that's facing our state and actually our nation today, that there are very few doctors that really treat. There are very few psychiatrists, number one, and number two, that treat children, and number three, that we have psychiatrists that are addiction specialists. So what does that say for most of Indiana? Except outside of Lake and Marion County, it's a rural state. And so they're left to really family practitioners, God love them, who try to do the best they can. But through this initiative that's going to happen on this very spot, we'll have telemedicine so that doctors from all over the state can get the help and assistance to make sure that they're getting the right diagnosis and delivering the right treatment for children and families. And for that, that's life-changing and life-saving for children and families. I can tell you this much, that hearing what's happening here today, first, I'm so proud to be a part of it. I have to thank the legislature for their support of the Department of Child Services. I cannot do this job. Nobody could do this job without the support of their governor. And no governor has supported children and families like Governor Pence. And I can tell you that based on what I've heard here today, today is a very, very good day, and the future just got brighter for people who suffer from mental health and addiction. Thank you.
A few final comments for you. Community Health Network, our mission is to enhance the health and well-being of the communities we serve. That's our responsibility. It's not somebody else's, it's ours. 60 years ago, some visionaries said we needed a hospital, and the first community hospital was here. It would be 60 years next summer, or next August, that it opened. Long people have said that as we expanded to other places, we would close this site. I continue to say we will not. This is our community. We will not turn our back on our community ever. So we made an announcement earlier this year. We're going to invest $175 million to create the new community hospital on this site, and that's underway. So when you see buildings coming down, remember there's something that's going to follow. Now, then we get this opportunity. And this opportunity makes so much sense for us. Most people don't realize that we are by far the largest provider of mental health services in the state of Indiana, by far. Others have decided not to do that. That's their choice. It's not ours. When you look at the ability, one of the problems with mental health is access. I know about mental health. I've got mental health in my family. I've got addictions in my family. And I've got to believe you have it in your families too. That makes it more my responsibility. This is personal. So when we said we needed more access, one of the shortages is psychiatrists. So next summer, July of 2016, Community Hospital will start our first psychiatric program. We'll train them here. We'll have 4 residents start. We've had a wonderful array of applications. And my point in all this is that you can't sit back and let other people take care of your responsibility. I see Dr. Henley sitting back there. You know, Dan Elsner called me 6 years ago on a cold call and said, "Bryan, are you interested in helping start a medical school?" Nothing against IU School of Medicine, fabulous school. We need more physicians. We need more primary care physicians. I said, absolutely. He said, when do you want to talk? I said, I'll be there right now. And we're engaged in that. 18 months from now, we'll have a real doctor, a new doctor pop out of Marion, 162 of them, and we'll have more doctors in this state. And now the governor's put together another task force that says, how do we expand residencies? This is all about collaborations. It's all about partnerships. It's all about our responsibilities to help Hoosiers. And we're committed to doing that. And with the wisdom and foresight of the governor and Dr. Wernert and the backing and support of Senator Kenley and Judge Bonaventura and so many in this audience, we're going to make this happen. So I just appreciate you all being here today, and at the same time, hold us responsible. Make sure that we do this. Make sure that we stay on time. Make sure that we open access. Make sure that we find ways to take addictions and behavioral care and make it real. I still believe one of the problems with especially with behavioral care is that we don't accept it as a real diagnosis. We have to do that. We've got to deal with it. It's not only is it a diagnosis and isn't real, it's a really expensive part of our healthcare system. I won't get going on that. I could talk all day, but we've got to address this problem. So thank you so much for being here. We'll be here for questions. A few of us will stick around if you have questions for us. There are press packets in the back. Please take one on the way out, and God bless you and Merry Christmas.